My name is Anton Gunn, and I'm excited to have you all joining us today. I'm an advisor to The Intersection, a Robert Wood Johnson initiative with a focus on leaders in advocacy and healthcare. And I want to extend a warm welcome to everybody joining us today. See, The Intersection is a place to convene, to learn, to share resources, and discuss what organizations are doing to build anti-racist healthcare systems. This is a community that encourages collaboration with others. It's a place to dig deeper and discuss what is working and what isn't working to help you to develop effective strategies for your efforts. Now, I want you to make sure that you check us out at meetattheintersection.org if you want to access recordings of previous conversations, resources from RWJF grantees, and short videos from equity leaders. You will find a wide range of helpful resources on the website. There's also a podcast called The Intersection, where healthcare and anti-racism meet, which is available on all streaming platforms. And if you're not following The Intersection's LinkedIn page, I want you to do that right now. I want you to follow our LinkedIn page. You can connect with others, stay up to date about future events and resources. So let's get to what we're here to talk about today. Today, we're going to explore equity in the new era of public health and how we can continue to adapt, strengthen, and transform public health systems in the face of ongoing changes. Now, historically, we know the public health system has not always been kind to all communities or groups of people. I'm talking about unethical practices, systemic exclusions from public health services, and sadly, some of this still exists. The governmental public health system is currently undergoing significant federal changes, including reduced access to data, funding cuts, changes to federal guidance, and disinvestment in diversity, equity, and inclusion priorities. We're also witnessing another shift, and that is the role experts play in advising governmental bodies. And I'm really thinking about the Advisory Committee on Immunization Practices. The changes have already started to impact communities, especially those with the greatest need for public health services. We know that change is never easy, but it's especially not easy when it's involuntary change. But this moment presents an opportunity to strengthen partnerships, build trust, reimagine a public health system that is more equitable and not just community informed, but community driven. So I got a couple housekeeping items that I want to run through to get us started. Please add your questions into the chat throughout this discussion. If you have a question, we want you to put it in the chat, because after today's session, we're going to record a podcast that's going to be with the panel that we have today based on your questions. And we'll cover some of the themes from today's conversation. So I hope that you also will stay for the breakouts that we have after the panel. The breakouts are an opportunity for you to continue the discussion and meet others doing the work. So if you plan on staying for the breakout sessions and you need to be in a room with an ASL interpreter, please send a private chat message right now to event support. I'm going to repeat that part. If you plan to stay for a breakout and you need to be in a room with an ASL interpreter, please send a private chat right now to event support. Now, before we dive in, I'm going to turn it over to Esther Boykin to get us grounded.
Thank you, Anton. And welcome to everybody. So how do we imagine public health in a way that is equitable while acknowledging the mistrust and challenges inherent in the current landscape? It's hard to imagine and collaborate when we are in the midst of trying to close immediate gaps and build bridges to strengthen tenuous relationships. Innovation and collaboration require breathing room in our schedules, in our systems, and within ourselves. As leaders, healthcare providers, community advocates, and every role in between, the demand to build equitable programs can feel incongruent with the current barriers and long history of structural racism. The needs are urgent, and yet the changes required often take time. And it is not always easy to reconcile this friction. But learning to pause and return to an internal feeling of possibility can help you discover new places for collaboration, imaginative approaches to old problems, and give you the tools necessary to navigate the road ahead. To change systems requires internal and external resources. This short grounding practice will invite you to create space and stillness internally as a means to prepare ourselves to be even more receptive to unexpected partnerships and maintain a spirit of optimism in the face of ongoing change. Let's start by noticing our breath. Don't try to manage it or control it. Just breathe and bring your awareness to the natural rhythm of your breath. Your breath is an anchor, a natural grounding practice that you carry with you everywhere. It's a rhythm, a reminder that your body knows what you need without the mind telling it what to do. If it feels safe to, feel free to close your eyes or soften your gaze. We're going to take 3 deep breaths, gradually extending our exhale. I will count as you inhale, slowly filling your lungs, diaphragm, and your belly. And then exhale slowly, allowing your belly button to sink in towards your spine. Inhale, 2, 3, 4, and exhale, 2, 3, 4. Inhale, 2, 3, 4. Exhale, 2, 3, 4, 5. Inhale, 2, 3, 4. And exhale, 2, 3, 4, 5, 6. Allow your breathing to return to a natural rhythm, feeling it ground you in this moment. And I'd like you to begin to visualize the communities that you're serving. Begin to imagine feeling seen and heard, everyone talking and sharing ideas. There is a palpable energy of hope and shared commitment. As you continue to breathe, just notice what it feels like to stand in a place where trust, wellness, and collaboration can flourish. This is the emotional space from which you are best able to chart a path forward. Now, slowly bringing your awareness back to your breath, and then gently back into the present moment. You might wiggle your fingers or your toes, and if they are closed, I invite you to open your eyes again. I hope that this short practice has helped you to bring more awareness to how it feels when you are open and engaged in the exploration of possibilities, free from the burden of immediate problem solving. And I invite you to bring this feeling into today's conversation as we explore alternate perspectives on how we move towards a more equitable public health system.
Thank you, Esther. I really appreciate that. I really appreciate that. And now let's get into the work. I'm pleased to welcome an incredible panel here today. Each speaker brings a unique perspective on public health work within the communities to improve health services and outcomes. And first, we have Ann Carter, who is the Health Equity Manager at Linn County Public Health. She launched the Office of Health Equity after 25 years of experience in corporate leadership. She leads efforts to remove barriers to care by bringing together partner organizations and the community to create solutions for communities facing the greatest health risks in Linn County, Iowa. Next, we have Shelina Davis. She's a public health social worker and a passionate advocate for building communities where everyone has an opportunity to thrive. She serves as Chief Executive Officer of the Louisiana Public Health Institute, a nonprofit organization that functions as an ecosystem connector, working at the intersection of health systems, community-based organizations, and residents to advance health equity. And then lastly, Lili Farhang is the co-director of Health in Partnership, a national organization that works to advance health equity by aligning public health practice with community power. She co-leads the organization's overall strategic direction and works with Robert Wood Johnson Foundation to support governmental public health operations, practices, and policies to reflect the priorities and leadership of historically marginalized and oppressed communities. So, as you can see, we have a dynamic panel today, and I'm really looking forward to our conversation. So, my first question is for you, Ann. I'm going to start with you, given your experience in Linn County, Iowa. And I want to start by addressing what we all know is the elephant in the room. What is it like working in local public health capacity right now? And how can public health use this time of significant change to rebuild trust in Black and Brown communities? Got to unmute yourself.
Terrific.
There you go.
Boy, many years of being on Zoom, and here you go. I'm unmuted now. Thank you so much, Anton. I'm really appreciative for the opportunity to share, and especially on one of my favorite topics, which is relationship building throughout the community. And so, yes, this is a time of significant change, and really coming together in forums like this is one of the most meaningful ways that we support each other, that we continue the work, and practice resilience. And so there might be a few people out there rolling their eyes when I use that word, but I'm very thankful, very grateful that we started with breathing. And just for a little bit of context, when I joined Linn County Public Health in 2022, it was a major career pivot for me. And the reality is that the collective trauma from COVID was very much a factor. And so I point that out to say resilience was important then, and it is still important now. And in terms of that elephant in the room, just wanted to touch on some things federally as well as what's happening in the state of Iowa. We are all impacted by extensive and consequential changes that are impacting most of our community partners, whether they're in the public sector or in the private sector. And in Iowa and other states, but in Iowa, legislation is impacting our work also. I'll highlight two new bills from this past session. And I'm not bragging, to be clear. Senate File 418 was the first bill that our governor signed into law this spring. It removed gender identity protections from our civil rights code after nearly 20 years. So that is the climate in which we are working. House File 856 prohibits public entities from engaging in activities related to diversity, equity, and inclusion. And I don't know about you, but I, for decades, was a diversity strategist in the corporate sector. And so I have seen so many, just an abundance of interpretations of diversity, equity, and inclusion that have no resemblance to the actual work. And so the last thing that I would say about that climate is, at least from my perspective, it impacts not only how we do the work, but also how we talk about the work. And on a very personal level, I would say that I'm still wrestling with that. I've agonized over that more than I'll care to share for this particular forum. But you asked about rebuilding relationships with Black and Brown community members. And I would suggest that we are still building. I'm not sure that we are rebuilding or that we have achieved that accomplishment. When I started in public health, I wanted to understand that declaration of racism as a public health crisis, and not only what it meant to our public health practices, but also to healthcare delivery and to our community members. And so I look forward to being able to share more about a work group that we convened, which was really modeled after a framework called the Spectrum of Community Engagement. Actually, the whole title is the Spectrum of Community Engagement to Ownership. And the idea being that we wanted to work alongside community members impacted by racism to co-create, to share power. And ultimately, we focused specifically on mental health. So I look forward to being able to share more about that work during this session.
Fantastic. We will definitely want to hear more about that. My next question for you, Shelina. As a public health leader and a racial justice advocate, what does authentic partnership with community-based organizations look like in your work?
Yes, thank you so much for the opportunity, Anton, and at the intersection. For me, authentic partnerships with community start with trust, as well as ensuring that we're centering the voices and needs of the community. For myself personally and professionally, as well as at the Louisiana Public Health Institute, partnership and trust are not just values, they're like the foundation for how we operate, because we've always known that we can't do this work alone. And in this new era of public health, is more important, now than ever, that we're working in deep relationship with community, in sustained and meaningful ways. And I would also say, I would be remiss if I did not acknowledge that this month, for those of us in the Gulf South, marks the 20th year anniversary of Hurricane Katrina, an event that, not only shaped my life personally, but also shaped, the state of Louisiana and the Gulf South, and also shaped our organization. These kinds of environmental, political, and social disruptions challenge us. I mean, we're in that type of climate today, and they present to us a choice. We can continue with the status quo, or we can move forward toward authentic partnership and transformation. So I know, I want to use Katrina as an example. After Katrina at LPHI, we made a deliberate choice to authentically partner both with our state as well as our local organizations to rebuild the greater New Orleans primary care infrastructure. And LPHI helped to administer over $100 million to community health centers, behavioral health providers, social services organizations. And we also piloted one of the nation's earliest patient-centered medical home models right here in the greater New Orleans area, which really helped to lay the groundwork for Medicaid expansion here. So in this example, I wanted to highlight that our authentic partnership really meant, in our role at LPHI, supporting infrastructure, even when it means challenging how the funding flows, sometimes taking on the strategic, political, and economic risk that community-based organizations may not always be able to carry, also serving as a backbone organization and knowing when we're going to lead, but knowing when we need to allow for community to lead and uplift their voices. And then also, lastly, I'll share an example, is that it just meant how we could advance not just evidence-based, but evidence-informed and innovative approaches that help to basically shift social and cultural norms here in New Orleans, like where people, we're really helping people, shift from going to the emergency room for their primary care to really going to community health centers that provided high quality, respectful care to people. So that's just one example of authentic partnership and what it means to me.
Fantastic. Thank you for sharing that perspective, and definitely want to dive back into a little bit more your experience. And I think it was a great call out that this is the 20th anniversary of Hurricane Katrina and what happened in the aftermath and in the transformation and the rebuilding of partnerships and infrastructure. I want to hear more about that for sure. Lili, I want to jump to you based on your experience, bringing grassroots organizations and governmental public health agencies together to achieve systems change. What advice would you offer to foster more effective collaboration between those two very different entities with very different focuses and agenda? I would love to hear your
Yeah.
perspective on what we can do for more collaboration.
Yeah, I appreciate that. Thank you so much for having HIP and having me, and appreciate the spirit and the energy of all of you. And I think what I'll offer builds in many ways on what Anne and Shelina started to talk about. So I think what we aim to do at HIP is really build bridges between public health and movements for social change, because we feel that both fields sort of share this ultimate aim of reshaping structures and systems and the material conditions that create health. And grassroots organizations, community power building organizations, AKA, they're a very particular kind of community-based organization. They do base building, they organize, they recruit, identify, recruit, organize, develop people from impacted communities to speak for themselves, to fight for the solutions that they want to the problems in their own lives, and to take collective action. And so they are a different kind of community organization, they often have very strong kind of political and social analysis and interests. And it can be super challenging to align that world of community power building organizations, grassroots groups, with government, with governmental public health for understandable reasons. We know the history. Katrina would be the is really and sadly kind of an excellent example that we can all look to for how trust between grassroots social movements can be completely destroyed with government. So for us, when we bring, and yet public health is governmental. And so if we want to kind of improve and reimagine the public health system, we have to sort of begin with government at the center of that institution, of that system. And so for us, when we think about bringing these really sort of different sectors together, we take a bridge building approach. We take an approach that is really trying to think about what, these differences really necessitate intentional, strategic attention. If we want the trust that Shelina talked about, if we want the mutual understanding that we know that we need for them to align around shared goals. And so we've spent a bunch of time with local groups, with local health departments, with grassroots groups. We have this initiative called Power Building Partnerships for Health that brings kind of pairs of local grassroots groups and health departments together. And we've talked to them around what those dimensions really are to advance something that we call inside-outside strategy, which is this idea that we want folks inside of governmental institutions and grassroots groups who are working outside of governmental institutions to figure out how to leverage their own power, respective power and voice and resources to achieve a common aim. And it really comes down to nourishing those relationships, spending time together as humans. What's your, what sport did you play growing up? What do your kid, where do you church? It's just about the interpersonal, individual kinds of relationships that are necessary for ever there to be an organizational level of trust. It's about developing people as leaders, irrespective of where they are on a hierarchy. But we can all be leaders of this effort to achieve racial equity, health equity. We have to build capacity, for those relationships to actually kind of sustain work together. They have to think about their political landscapes realistically, everywhere. You cannot set that work aside. And you have to develop an analysis that guides the work. And so we talk about this as the 5 dimensions of inside-outside strategy. I can get into it more, but that's the advice that I have for grassroots groups and governmental public health who aim to work together.
Fantastic. Well, thank you very much for sharing that. I definitely want to come back to that inside outside in 5 dimensions, if you will. But Ann, I want to come back to you right quick. In your opening comments, I asked a question around rebuilding trust, but you used the phrase, we're still building trust. And you wouldn't necessarily say rebuild because you have to build it. So my question is, in that context around improving trust and health for overall, how can public health work alongside the community and work alongside healthcare? Because we know hospitals play a role in this and other health entities play a role. How can everybody work together to improve trust in healthcare for overall? And please share any perspective you have in Linn County on that.
Yeah, thank you. 2 things come to mind immediately. First of all, Lily's comment about just spending time together as humans is so true. But that may not come naturally for us, whether it's our own public health practice or healthcare institutions. And so what I seek to do is to model what that looks like, which means that when we were coming together, even if it was a meeting, we were really learning together how to hold space for people to talk about lived experience, and not just the persons of color, but for everyone. What does it mean to listen to somebody's story and not think that your immediate reaction has to be to solve some sort of problem? but
Mm,
just to hold space
mm,
and to care.
mhm,
That's where it starts. And then we would do exercises such as not breathing necessarily. Oh, we did do some breathing actually, but activities where we spent a whole meeting talking about racism. What are different
mm,
types of racism, and how does that show up in your life? How does that show up in your institution? So those were some really fundamental activities to how we got to know each other and how we got to respect our differences, because we
mm.
didn't necessarily always agree. And so I hope that that we were modeling that for our partners, and I think that that's an important role for public health.
Fantastic, very good perspective, and I think it's a grounding one for me is that it's going to take time. You got to spend time with people and spend time together. Shelina, I want to ask you. I heard you say the word power. And this is one of the things that I'm noodling on is that institutions have power, communities have power in different ways. So I want to hear what are the lessons that you've learned about power sharing, okay? And that's in the context of with health systems and community partnerships. What does that look like in a real sense for a shared power towards a positive outcome that leads to equity and justice in a system, if you will. That's the best way I could come up with it.
Sure. Yes, Anton. I mean, I think in terms of lesson, it goes back to what both Lili and Ann already shared. I mean, this work is deeply relational.
Mm,
Yes, I know power is real. It shows up in many different ways, through folks who might have the money or socially or politically, or through institutional influence. And I feel like, especially as we're talking about health systems, many times, especially in our community, health systems often hold a significant amount of that power in our broader public health and healthcare ecosystem. But within these systems, people are there, and people
mm,
who live here in Louisiana, people with stories, with families, they may be our cousins, our
mm,
ATs, our neighbors. So I think really making it deeply relational is the important piece. And one powerful example I wanted to share around this in particular, because it kind of crosses healthcare and that power piece, is our work to improve maternal health outcomes in Louisiana. And as you all know, I mean, our maternal health outcomes in our country are abysmal, but when we look at maternal health outcomes in the state of Louisiana, we have some of the worst maternal mortality rates in the country, and we know that Black women are disproportionately impacted by that. And in 2020, heart-related conditions and accidental overdose here in Louisiana were some of the leading causes of maternal deaths here in our state. Yet the
mm,
report that was released that shared this data from 2020 wasn't actually published until 2024. So that's a lag our communities really just can't afford. And so
mm,
actually, and I think we have some of the folks on the line, that's how this initiative that we steward called the Louisiana Pregnancy Registry actually came to be. We had partners like Dr. Veronica Gillespie Bell, who is at one of our large health systems and also is the maternal mortality lead. Also, maternal health experts like Dr. Shervington and Richardson from the Institute for Women and Ethnic Studies, and other community partners, doulas, health department, who really said, we cannot afford to keep getting this data late. Like,
mm,
don't you all have a tool or something that we can work
mm,
together to create
mm,
so that it can be both stewarded in a responsive way, but also a responsible way, but also responsive to community. So we leveraged our role as a connector and the power that we played on the data space between public health, health systems, academia, and community to design this tool that really reflects what's happening on the ground right now. And we also knew that data alone is not enough. Our work included access and expanding access to doulas and birth workers and helping them engage with this data and with health systems in a way to help it be more collaborative and impactful in the work that they do every day. So I would just say, like, a lesson, obviously this work is relational, but also as Ann and Lili mentioned, this work, authentic partnership and share power and relationship is a practice. It's not just a checklist. And it's a practice of ongoing dialogue, but then also it's also grounded in community wisdom as well.
Well, I think that's so phenomenal, a phenomenal point that you raised. When you said share power and you talked about the data, not data being all things, But that is one aspect of power, that if you have information and insight that another vested entity and partner doesn't have in the community, bringing that to the table could be a significant leverage point to help you to build trust and to help get to a solution. So I really appreciate the examples. And I know you were talking about maternal health. We recently had an intersection event around reproductive health justice and heard some of these startling statistics around what are the challenges and opportunities, the importance of doulas and midwives, and how people should be able to have the ability to give birth on their own terms in a way that they're supported and nurtured in that. And so, sounds like a great experience and a great lesson that you have there. Lili, I want to jump to you, and I want to go back to your 5 dimensions of the inside outside game. I'm a former athlete, played football, but also played basketball. And I know the teams who win championships, they got an inside game and they got an outside game. So I really want to hear some context of how do you use these 5 dimensions to achieve health equity in a reimagined health system. And can you share any examples of success in that space?
Yeah. Yes, it is. Comes from sports. And I think we have a lot to learn from like other places that know how to think of achieving kind of equity and justice like through a multidimensional strategy. I think that you cannot kind of approach this work like in a linear kind of way, but there is just constantly stuff coming at you from everywhere, and you have to be able to like be prepared and to handle it. And so strategy is highly important. It's just like revisiting strategy, going back to it. What is it that we're aiming to do? How are we trying to do that? And I think to answer your question kind of more specifically, the animating goal, I think for us at HIP, and it definitely like Anne talked about the spectrum of community engagement to ownership. This woman, Rosa Gonzalez from Facilitating Power, is the lead, it's the entity that like put that spectrum together. And in the very end of that, this idea of community ownership, we often talk about that as co-governance, right? So for our, the sort of like animating goal or vision behind these dimensions of inside-outside strategy are to ideally, hopefully, build a public health system around the concept of co-governance, which really emphasizes shared decision-making and collaboration between government and communities, and particularly for communities that have been most harmed by government systems. So I'm not talking about, sorry, don't hate me, the restaurant association community. I'm not talking about interests that already have power. And, government is a terrain of struggle. Like those with dominant power have either captured, I think, governmental authority for their own benefit, or they dismantle it when it poses a threat to their interests. That's, in my opinion, what we're seeing right now at the federal level. And so I think, if we can accept that current governance structures really reflect unjust and inequitable status quo, and know that so many people, I mean, my roots are in governmental public health. I worked at the New York City Health Department. I worked at the San Francisco Health Department for years and years. That's like how I learned kind of how power actually works. And there's so many people and teams who share a vision of justice and equity in government. And they have access to data, to information, to resources, to decision-making arenas that can be leveraged towards this concept of co-governance. And so for us, that's like that's what these 5 dimensions are about. It's like about building towards a co-governance strategy. And I think governmental public health is really ripe terrain for that work because of our legacy in social justice movements, because the social justice motivations of so many people in the public health workforce. And one example I'll just share, showing a lot of love to Louisiana right now, is an example from New Orleans, and it's called the Campaign for Dignity and Respect. And it's a partnership that developed through a grassroots community power building organization called Step Up Louisiana and the New Orleans Health Department. So they joined forces to actually build a campaign around protections for low-wage workers in New Orleans. They really adopted this inside-outside strategy approach that I talked about to align their work to pass this workers' bill of rights. Despite working in kind of the state that's generally hostile to worker protections. Hopefully that's not a shock to anybody to hear. And that campaign was rooted in this like shared understanding that economic insecurity is bad for health. So Step Up Louisiana, like from their outside role, they mobilized workers and built a lot of community energy and momentum around a $15 minimum wage demand, paid leave, union rights. Meanwhile, on the inside, the health department provided data, political insights, talking points, information to really bolster the case for this change. And then this is amazing, but together they crafted a ballot measure. Like together they crafted a ballot measure and ran a citywide campaign that connected workplace dignity with health equity. And the bill passed in November 2024 with 80% support in New Orleans. And so that's like an example of what I mean by co-governance, their work together, the victory. It shows how this inside-outside strategy between grassroots groups and government can align around shared goals. And that success was shaped by years of trust building. They were participants in our Power Building Partnerships for Health initiative, but they had been building and loving on each other for years. And so that's sort of that's like what animates us around a reimagined public health system. I think when you watch the disintegration that's happening, which obviously has happened at prior points in history, we can get into all of that, but it really kind of does show the importance of like getting into these systems of governance and like not assuming that like the ballot box is the place where everything starts and stops, but governmental public health administrative agencies have an enormous amount of power to support communities. And I think we want to shine a light on that in more explicit ways. Yeah.
Very good. Shelina, you want to add on anything to that? I see your head nodding vigorously over there.
I'm very familiar with the initiative that Lili mentioned, and also very familiar with like the New Orleans Health Department director, who's also on our board. And I will just say, to your point, Lili, about the power that governmental public health brings. And I think even in these moments, and you're talking about in New Orleans, in a state where, a lot of folks see what is happening and, how there's a lot of anti-public health things happening, but in pockets of Louisiana, the work still happens because we have leaders who are committed to this work. So we have folks like Dr. Jenna Vegno, who is the health department director, who's also an ER physician who continues to work, but she cares deeply about community. And so I think, just I guess reinforcing this inside-outside strategy and the relational piece is that it's so like there are leaders who are in these spaces who we don't even know, who are even in spaces where we think are hostile, but the people, if you actually talk to them, there may be things you could get done, even kind of on the low, to support and advance equity still. So I just wanted to, elevate and just, highlight, amazing work is happening even as people are seeing
in the midst of it all. Yeah.
Yes, exactly.
Yeah, that's a good context about getting the work done on the low, if you can get the work done on the low, because there's allies and supporters and partners everywhere. Now, I have a question that I'm going to just pose to the group, and I kind of want to hear from all of you on this. We're going to do a poll in a few minutes, but right now I wanted to talk about, the real reality is that you all are doing some incredible work. You got some great examples of things that are going right. But we also know that there are things that don't go well, mistakes that have been made, challenges that you have had. And we have a lot of people watching. I think we got over 1,000 people on this session right now. And some of them might be in some places where this is their first day doing this work, or they might have just started in a new role, trying to build a bridge and rebuild a public health system or build trust with community as it from a relation to public health. What are some things you would tell people to make sure they don't do? Okay. And I'm going to just say it very simply. What should you not do if you're trying to build towards health equity, build trust, build partnership in communities? Are there any lessons that you could share with people that might have been a mistake, either that you have seen happen, heard about happening, or have some context around? And I'm gonna start with you, Ann, because I want to just go ahead and start with you, because I know you have some thoughts and opinions about a lot of things.
I have a strong opinion on this. It may not be a popular answer, but really what I would stress before anything else is don't rush the process. And, I came from the corporate sector where everything was an emergency yesterday, and we needed a solution last night. And so while much of the work that we do, in fact, is really life or death, this idea of being relational, Shelina, I think you used that word, is not something to rush. And so in my mind, when I started this work, I thought, oh, maybe, a couple meetings and we'll be good to move on to the heavy stuff, and that wasn't necessarily the case. Or we'd make progress and then we'd have to kind of step back because there was a new learning or whatever. And then part of that rushing also is sometimes we rush because we are afraid of making mistakes or afraid of saying the wrong thing. And really we have to, I'm going to say, lean into that and kind of expect that and know that it's okay to pause and to breathe and then to continue on. But yeah, my number one piece of advice is don't rush the process.
Very
Have
good.
specific goals, but know that you can't rush the process.
Yeah. How about you, Lili?
Okay. The negative framing of the question is a good one. I think it's don't have assumptions about people. Like when I just go back, my first job in public health was 1999. I thought I was so smart. I thought I knew everything. I had spent all this time studying, talking, and I walked in and I had all these assumptions about people, about how things should get done, about who to partner with, who was cool, who wasn't cool. I mean, really, like and I think it's incredibly hard. Like that was 26 years ago. And it's only worse now. You know what I'm saying? Like it's only worse right now. The way that I think culturally we're being primed to like have assumptions about who people are, what they stand for. And I think that this moment in time calls for multiracial, multi-sector, all the things kinds of movements to build our power to win. And I think if we come in giving some people the side eye, thinking they're not this enough or they're not that enough, we're gonna keep losing. And so my feedback, or my advice for someone who's starting to work on day one on these issues of equity and justice is like look for allies in every corner. There is no litmus test. I really believe that. And it doesn't mean you can't have feelings about what people say, and if you disagree, you can have those feelings, but no one is disposable, no. And so we really need to be approaching this from the lens of, dignity and humanity and all those words in ourselves when we're approaching building with other people to do this work.
Very good. Man, that's so powerful. Really powerful. Shelina, how about you? What advice would you give to someone of what mistakes not to make?
Lili took mine, but I'm going to add on. I said, don't make assumptions because of how you framed it and seek first to understand. And I guess, especially as someone who lives in Louisiana, I'm a Louisiana native, people make assumptions about Southerners and red states and all of these things. And similar to Lili's point, like we are inviting everyone to the table. Like we may not agree on everything, but we all want healthy, thriving, prosperous communities. And so starting there and seeing where we can align and bringing in those like, unlikely allies is something that we all need to think about. And then in how we relate to people, like don't make assumptions based off of the book or what you see, the book cover or what you see with anyone. That is what I've learned, period. Is that you just seek first to understand, get to know people, and see where people have shared priorities to advance health and racial equity.
Oh, so good. So good. You both mentioned, how smart we all are. We go to school, we get the education, we get the training, not recognizing that the textbooks may be embedding bias of what we think about people and think about communities. And we got to unpack all of that. So the framework of assume nothing, don't assume bad intent, don't assume that people are ignorant and unaware, but recognize that everybody can be a partner in the solution. I think that's gold and that's phenomenal. context. Now, we're going to pause the conversation right here for 1 minute while we share a poll. Now, we want everybody who is watching to let us know if you plan to stay for breakout groups. We're going to have some breakout groups, and we want to give you a chance to tell us yes or no if you plan to stay. Of course, we hope that everybody stays for all of the breakouts and meet with their peers and share as a part of the breakouts. But we need to have a sense of the crowd, and that'll help us to plan on how many breakout groups we have. And we want to make sure that we're clear. So please, please, please select the poll right now. Let us know. And then if you have questions for the panelists, please drop them into the chat. Okay. The breakout groups will start right at the top of the hour. Okay. And I promise you, we'll get to them as soon as we can. They'll start at the top of the hour. Great question that somebody asked in the chat. I saw that there. So everybody should have taken a poll now. Again, we're gonna start back at the top of the hour. I want to really get to what I call my last question, but it ain't really the last question because I might think of something else because this is how I am. I want each panelist to give me their perspective in the context of everything that's going on, the challenge that we know exists, both from a federal standpoint, things that people are dealing with at the state level, and how that's trickling down to the local level that makes it hard for us to build a solid, trusted, equitable public health system infrastructure in the state. We know we got the challenges, but I really want to hear from you each about what gives you hope for the future of public health in this country. What gives you hope? And if you have an example to share, it might be a person, it might be a project, it might be something that you have seen recently. But I really want to try to understand what gives you hope. What are you leaning into at the moment that shows you that as Kendrick Lamar says, we're going to be all right in the context of public health in this country. And I'm going to start with you, Lili. I'm gonna have you go first and we'll go in reverse order.
I just took my 11-year-old to see Kendrick as his first concert, so I'm like always welcoming an opportunity to remember that amazing show. Okay, this is almost it's like narrow. It's like inside baseball. But what gives me hope right now, it's not so much about like the system and the opportunities and all of that. For the first time in the 20 something years that I've worked in public health, organizations who have basically like been doing parallel play with each other at the public health level are actually like setting aside kind of turf and competition and like all this stuff that has kind of hamstrung us. We're a national health equity racial justice organization. There are many other national health equity organizations. We were always homies, we were always like knew how to play together. But I would just say that there was always a thing that like held back this idea of an ecosystem approach. And so what is giving me hope is that I actually think so many people are setting aside, and so many orgs are really setting aside some of that, at least from my perspective. There's new things popping up. There's old folks adapting. I think there is this understanding. It's like it really does take this whole ecosystem to move together. We can all occupy different spaces and have different lenses, but I don't know, the conversation, they feel so much more raw and frank and real and like able to kind of get to it more quickly. There's less posturing. So I want to say the question was, what gives you hope for the future of public health in this country? And I will say, I have to like really just think about our movement. And I actually feel like what gives me hope is that there feels like this concept of a movement, and thinking about us as like aligned in a movement forming gives me hope, because I think if anything we've learned these past few years is like, if you don't have your act together at a movement level, like it's gone, So that's me. That's what gives me some hope.
Fantastic. And you talked about two bills in your state right now, some other challenges. What's giving you hope right now?
One of the things that is, I have the benefit of working with colleagues at the University of Iowa College of Public Health and the opportunity to present to students who are either undergrad or pursuing their MPH or perhaps a PhD in public health. And so just hearing their questions and their genuine interest in, why we do the work we do, what inspires us, that gives me hope because they're thinking about the future. What I would like to see us do better, and I know this wasn't exactly your question, but just as I care deeply about building trusting relationships throughout the community, that includes, and Lili touched on this, what I think of as multi-generational relationships. And so whether it's my job here at public health or some of the social justice work that I might be doing on a volunteer basis in the community, I've been, at this point, I've been around the block once, maybe more. But to see, youth, whether they're teenagers or college students or, new to their careers or just trying to figure stuff out, we really are stronger together.
Yeah, I think that's a great point, and it's definitely been called out in the chat as well. Whether it's Black and Brown communities, Asian American communities, or the LGBTQ plus community, we have to make sure that we build all bridges and bring everybody into this conversation as it relates to the public health system. And so we appreciate those call outs in the chat and know that a better public health system has to be one that is for all. So Shelina, I'm gonna go to you next. What is giving you hope right now?
I think what gives me hope, the people, I think in public health in particular, it's one sector, but in public health, our world is so small. I'm looking at all the chat and the people that I know from across the country who I've worked with in some capacity or who I'm in school with. And so I feel like we all are in spaces and places where we have power to make meaningful impact. So that's one. And then two is in this moment where we know where, public health is being dismantled left and right, governmental public health is, funding is, being, eliminated left and right. It is forcing us in this moment to really reimagine a future that's not solely relied on governmental public health. And we've already acknowledged that, these systems that were created were not always designed to support many of us. And I think, it's really going to require us, one of my colleagues says this concept of human need is going to really require us to really think about how we address human need. And that's not just a public health issue. There's organizations like United Ways, Volunteers for America, others, and grassroots organizations who've been addressing this even, I know somebody mentioned the Black Panthers in the chat, organizations and movements who have been addressing human need. So it's forcing us to reimagine public health in a whole different way. So that's also giving me hope during this time.
Fantastic. Well, we could definitely talk all day about this, but it's time to transition to the breakouts. So first, I want to thank you, Ann, Shelina, Lili, for being here and sharing these phenomenal insights. I hope everyone will stay connected with The Intersection. You can sign up for updates at meetattheintersection.org. Again, please follow our LinkedIn page and please subscribe to the podcast on Apple, Spotify, Amazon, or wherever you choose to listen. And now we invite everyone to stay for the breakout groups. We have some great breakout groups. If you cannot stay, we just appreciate you exiting promptly so we know how many breakout groups and participants to expect. And we'll transition to the breakout groups in just a moment. I want to thank you all again for being here for this event, this intersection event. It's been a pleasure to be with all of you, and we look forward to the next opportunity. You all have a wonderful day.